Reflective practice was something I didn't get at uni. I got it, I was told to do it, but I didn't understand it. So when I went on my placements, I was very lucky that I had supervisors who were very strong and made me write down my reflections. And that was really tricky for me, so I figured it must be tricky for other students as well. So when I started taking students, I sort of followed that same model. And so for students coming to deadly years, and it might be their first sort of experience in working alongside Aboriginal and Torres Strait Islander people, or in to try and understand their own culture and how that impacts on providing services to people from another culture. So actually every week I have set questions that they have to write down and respond to. They don't have to share all of that with me. I don't make them send it to me, but we certainly discuss what were the key things of that during weekly supervision, so that they and that if reflection is tricky for them, then we need to develop that, because at the end of the day, when they walk out of a project placement, they're going to be walking out with clinical reasoning skills and not so much clinical skill development, so that if their reflective practice doesn't develop over that time, then they're not getting bang for their buck out of a project placement. So I need to make sure that they're thinking about themselves, they're thinking about themselves in this context, and they're thinking about, what does this mean for me as an occupational therapist, and what will this mean for me when I'm an occupational therapist working in all sorts of places and spaces. What's gone really well this week, what's been really challenging about this week, what are some of those aha moments that you've had this week, whether that's around cultural aspects, around, oh, that was really interesting, or particularly when students first come here and we ensure that they've done some cultural awareness training, that they've been able to have a yarn with different Aboriginal and Torres Strait Islander folk in our program, so that sometimes, it's this sort of aha moment around diversity in Aboriginal and Torres Strait Islander culture and those sorts of things. Also getting them to think about, well, what are you going to do with this information? How might that inform your project? How might that inform your clinical skills and those sorts of things? So it's not usually it's just open-ended questions that give them the space, but also make sure that they take the time and space to do that, because when you're not doing all this sort of seeing patient after patient or client after client, then they actually, I think, sometimes have the headspace to reflect on not just their placement, but kind of, this is where OT, curriculum has got me to now, and this is kind of how I might be able to apply that in the future.